Good afternoon, everybody. This is Dr. Rostenberg again, and I am excited to bring you a brand new video with brand new information and science that we haven't really talked about before on my channel. This is all new to me as of about 10 weeks ago, these ideas and the research I'm about to share with you. It's only been part of our practice, on our radar screen just for a couple of months, and in that time, it's really had a big influence on how we think and how we practice. So there isn't very many times that a new tool comes along, a new idea that really has that big of an impact on how we practice. But what I'm going to share with you today, talking about the science behind stem cells and then going into the tool that we call stem cell activation patches, giving you an overview of what that is, you'll start to understand why we're so excited about this technology, basically. So first we need to look at the stem cells, and we'll go into the patches and give you a little more information on that. But I think you're going to like what you learn in this video. So stem cells were discovered all the way back in 1961. These two scientists here in front of you, these are the gentlemen credited for making that discovery. These are the cellular biologists who back in 1961 discovered stem cells. So they've been around in the scientific literature, or we've known about them at least that long, but only recently has the power of stem cells really begun to be appreciated. And you know, it's really driving this whole industry called regenerative medicine. We like that idea. We have an aging population. We don't want to be falling into the traps that our parents fell into. Some of us have taken care of ailing grandparents or ailing parents, and you see how many medications and drugs people get, are forced to take, basically, as the medical profession really tries but doesn't do a great job taking care of people. So the regenerative medicine area is an area where people are going to be able to promote proper healing at every stage of life and just regain function, so that you don't have to be on 12 different medications just to get out of bed in the morning and walk around. And there's better options out there. Of course there's better options out there. And so this idea of stem cells ties into that. They're just sharing with you, this is from Duke University, that by next year, 2021, not too far off, the growth in this industry is going to be up to about 50 billion from 17 billion just 5 years before. So those are big numbers for my little brain, but it's just showing you, hey, there's a huge investment, there's a lot of interest in this area. And even in the traditional medical world, stem cell treatment has been used for a long time. Cancer cells grow quickly, they develop chemotherapy to kill fast-growing cells. But we also have fast-growing cells. So, our hair cells, cells along the lining of our gut, and obviously our white blood cells and red blood cells are very susceptible to chemotherapy. So the medical profession developed a technique where they take your blood, they spin it, they remove the stem cells, they set them aside, someone goes through a chemo treatment, and then the stem cells from that person's body are reintroduced shortly thereafter to help offset the negative effects of chemo. So we don't want to see ourselves or anyone we love have to go through chemo, but hey, if you're able to use stem cells more effectively, there's some good science there. So that is, again, kind of the standard oncological cancer treatment way of using stem cells, but there's way more to the stem cell than this study and this information portrays. There's obviously some moral problems getting stem cells. I'm not a huge believer in science playing around with, playing God with life and trying to clone people and, put uteruses take a uterus out of a female and then surgically introduce it into a male and try to have a baby. That's just not my cup of tea, not something that gets me excited about science. So there are definitely some moral issues out there. And I think many of us would agree that how some stem cells are harvested, from aborted fetuses, that's just kind of an unacceptable way to get your hands on cells as well. So I'm not trying to get into that argument with you, just to say, thinking people with the conscience are going, stem cells, they seem amazing. There's great research, as you'll see here in the next few slides, but some of the time that stem cells are harvested, it's kind of gruesome, and I don't really want to be a part of that. And I would agree, professionally and personally, I would agree with that. So we want to be able to use stem cells, but we don't want to have to, get it out of the cord blood of a woman who just delivered, although, maybe those are ethically harvested, is still very expensive, very time consuming, that kind of thing. Here's a study that shows the average treatment for stem cells. Here's somebody trying to treat their arthritis with some stem cell injections. It's like $5,000 to $8,000 per treatment, and it may not even work. Nobody has a 100% guarantee that it'll work. But that's the price of a used car or a nice long vacation and lots of other things that you could spend that money on. So we're looking for ways to use stem cells, but we're looking for a method to use it in an economical way, because I personally couldn't really afford that very much, and I have a lot of patients that they're on a budget and they don't want to spend $8,000 just to see if this will work. There's got to be another way, which I'll talk to you about here in a few minutes. But as I said 10 weeks ago, didn't really think about this at all, and now here I am putting out another video. I really feel ethically that if I'm going to talk about something or use it in my practice, I have to do my own due diligence. So these are the research studies that I've referred back to that have helped me understand how this process works of using stem cells in practice for better patient outcomes. Okay, so when I started to look at stem cells, what I'm actually looking at is this pathway called GHK. The GHK peptide pathway is the pathway that produces stem cells in the human body. If you stimulate GHK pathways, you get more stem cells produced. And I start to look at the research and I'm just kind of blown away. And the reason why is I have tens of thousands of references. I've spent tens of thousands of hours studying health. I just like it. I'm only OCD 99% of the time, I just got to chew on something interesting, and I've done a lot of research. But I rarely find something with this much positive review in the literature. Meaning this: excellent safety record, wound healing, tissue repair, remodeling, anti-inflammatory, antioxidant, DNA repair, gene modulators, reverse expression of multiple genes involved in biochemical pathways associated with cancer growth. I've lost friends to cancer, and I'm not, that old of a person. And I know that the more years we live, the more people we have to see succumb to these problems. I want to find a better way. I think as a society we could. So, that's what drives us to go to work every day and work on helping people. But that's a nice long list of positive aspects of these GHK peptides. They're a powerful healing pathway. GHK has a distinct action. It increases your collagen, elastin. It helps blood flow. It reduces inflammation. It improves stem cell proliferation. Right there, ding, ding, ding. That's what we want. Okay, it just helps people. There are some things out there that just helps people, like these guys having a fun time in the mud, getting them to the spa. Do you think that reducing stress has any negative impact on a single living creature on Earth? I cannot find any data that suggests lowering stress does anything negative for you. I also think, as we're going to see, that increasing stem cell function has no negative effects. It only helps us in a world that seems to be out to get us, especially lately with all the shenanigans going on, right? We need everything we can to promote health if it's safe, ethical, and effective, right? Tell me more about that stuff. So, just more research. This is, again, from 2015. It restores the ability of fibroblasts to replicate. So fibroblasts are what form your collagen. They have a big influence on collagen, your joint capsules, your ligaments, your tendons. A lot of us have injuries and scar tissue. The assumption is as we age, we just never get it back. It's just, that's my old injury. It's why it still hurts. Well, I always ask the question, well, if that's your old injury right there on your knee, what about the other 800 injuries you've had since you were a kid that don't hurt you at all? Why does that one still hurt you, but the 800 other ones don't, right? It's an interesting question. It's because sometimes the body just isn't able to heal something without a little bit of help. That's what we see in practice. So this pathway, this GHK copper peptide pathway, accelerates wound healing of the skin, hair, GI tract, bony tissue, the foot pads of dogs. It's been found to tighten loose skin, improve elasticity, skin density, and firmness. Those are cosmetic issues, but they also reflect health, right? Youthful skin, healthy skin looks good to your eye, and it also reflects an inner health on the inside. And people spend a lot of time money and effort to try to improve their complexion. There's nothing wrong with that. But stem cells need to be part of your awareness of that now. So these are some of the studies that really blew me away as I was digging into this. Being interested in genetics and researching it and talking about it for years now and using it in our practice. When I found out that the GHK pathway controls over 4,000 human genes, it blew my hair back. Not that I have that much hair left, by the way, but anyway, it blew my hair back, and it resets the DNA to a healthier state. I'm just thinking to myself, like, man, this is really interesting, because this is what we do in practice for people. We try to help them optimize their genes and change their life. So here's a pathway that does that. 4,000 human genes. I don't know of any other pathway that I'm aware of that has that much influence on genetic expression. So I dug a little deeper. I looked into other research that's saying GHK is the most active of 1,309 bioactive substances, the most active, uniquely capable of reversing the expression in this study of 54 genes that were related to cancer. Please tell me more. The world is stressful. The world is toxic. If you're born after 1960, you have a greater than 50% chance of getting cancer in your lifetime. We've never, ever lived through a world like this. We need everything we can to help stack the odds in our favor that we can enjoy abundant health, guys. And that's why we're on this channel in practice, showing up to work every day. And that's why you're here as well. So I'm just sharing with you, the GHK pathway is legitimately a powerful pathway. Now, another big area of focus in our practice is anxiety and issues with catecholamines and dopamine and neurotransmitters. We talk a lot about that. We see a lot of connections between people with hidden gut problems, fungal overgrowth, bacterial overgrowth, and neurological or psychological problems they can't fix. Well, you can't fix your brain if your gut's a mess. And we know that. We've explained that in videos, and we see that in practice all the time. And so here's some data that really, again, kind of resonated with me. It shows that anxiety and pain, genes involved with anxiety and pain are very much affected and impacted by GHK. So GHK, the stem cell pathway peptide, increases the gene expression of these opioid and cannabinoid receptors. So what that's saying is, if you can increase GHK expression, you're going to express receptors in your body that allow your natural morphine and natural painkillers to work better, which just takes people out of chronic pain. One reason why people are in chronic pain is they've lost function of the enkephalin, the endorphin system that's supposed to give you that runner's high, supposed to take the pain away. Many people suffering with chronic pain just have lost function of that pathway. So what we're seeing here is if we can increase GHK, we can help that system right along. And then, again, I'm not going to get into the discussion of like copper toxicity and zinc and cryptopyrroles. That's something we look at in practice, but this is really just a different discussion. There are actually people out there, because of modern diets, who are copper deficient, believe it or not. And when healthy men were fed a low copper diet, their plasma opiate levels dropped by 80%. As soon as copper was restored, that level returned to normal. So what they're saying is GHK is really a copper peptide. I mean, you can't survive, you will die without copper in your body. You don't want too little, you don't want too much. But one of the things it does is it's connected to GHK. So what they're simply saying is GHK function increases when your copper levels are balanced, and it allowed the plasma opiate levels to go back to normal. So, people who are dealing with chronic pain, it's a really, really big problem. And I believe one of the main reasons they has to do with, like I've talked about before, like high catecholamines, high dopamine syndromes, high adrenaline, chronically stuck in fight or flight. There's a lot of data on that. But now we have data to support the GHK pathway as a contributor as well. Way back in 1975, so this wasn't, or 1973, this wasn't too long after stem cells were discovered, they figured out that the GHK pathway was a growth factor for liver cells, and it also helped neurons develop. So you're seeing now the connection in the research between stimulating stem cells through GHK, helping liver problems, helping the liver regenerate. It has a big, quick impact on neurologic health as well. So again, not my opinion. These are just nuggets from the research that we've been finding over the last few weeks in our practice. Here's a nice summary from 2018, and I mean, I'm not just going to read them all for you, but what's listed on your screen, people spend billions of dollars every year trying to support these pathways. In practice, we always win if we can find something that has leverage on multiple levels and areas. That's the same reason why methylation and MTHFR is so important to understand. It's important to treat, because if it's corrected, then you get leverage across multiple systems. They all will get better and fall in line. Well, the same thing appears to be true with GHK copper peptides. Skin, cosmetic, healing, chronic illness, inflammatory disorders, cancer. I mean, this is just what the research is saying. This pathway has a massive effect on. So you can imagine a researcher like myself and a practitioner, I start to read this stuff and I think, wow, this could be a really good tool to help my patients. So the thing to remember, though, is as we age, here's what the research says. At age 20, the plasma level of GHK is about 200 nanograms per milliliter. By the age of 60, it declines to 80. So part of the reason we age is that we lose stem cell function. And I'm not saying I want to live forever, but I want to be healthy to the very end. I want to live a nice, long, healthy life and love my family and meet my grandkids and maybe my great-grandkids. I think that'd just be a really cool life experience. I want that. But I know in order to get there in today's toxic world, I have to really be proactive, right? We have to think about how we're going to get there. So this has got my attention. I know my patients are dealing with chronic issues of all kinds, and they've tried a lot of different things without good results. And if something like this pops up, I'm going to pay attention. And so now I'm going to share with you a little bit about the tool we have in the practice that helps you get access to this kind of pathway support in your body. How could you, listening out there in YouTube land, support your own GHK pathway? So obviously at 200 nanograms per milliliter when we're 20, down to 80 at age 60, we want to do something to raise. Every decade of life, it's going to drop. We want to raise it up. If we can raise it up, we're going to heal better and enjoy life at a higher level. Okay? But I have to warn you, some people are very sensitive to what I'm about to talk about. You're going to hear me talk about an incredible natural medicine tool, but it is sold through a multi-level marketing company, and I know I've certainly been on the receiving end of their sales tactics, and it kind of rubbed me the wrong way. And that's just been my experience. I know it's been other people's experience too. But, and this is a big but, you can't throw all of that, sales process away. You have to keep an open mind, because something might come along that just happens to be sold that way that could really benefit you or make a positive impact in your life. And that's where I'm at. I heard about these patches from a colleague down the road here in Idaho, and he's a trusted friend of mine. I just didn't know what to do with them for a few weeks, and a little voice inside my head said, man, you should at least research it and see what it's about, see what's going on. And so that's what you've just gone through there with me, is the research. So now what I'm going to share with you is the product and how it works, and share with you some case studies that this product has done for people, and you can get a feel for what it might be able to do for you. So again, if you're just turned off by that whole idea and you think I'm just out there to get rich and buy a Caribbean island and retire, then thanks for hanging out. But if you have an open mind, you want to hear a little bit more about what I'd use in practice and how you might be able to use it for yourself, here we go. Let's keep going, and I'll tell you all about that. Okay? We're really going to be talking about how to activate our own stem cells. That's real important. We're going to take advantage of all the stem cell science, but we're not going to be injecting anybody else's stem cells. We're not going to stick ourselves with any needles whatsoever. In fact, we're going to learn how to activate our own, which to me is way, way smarter in the long run. So these are some case studies I just thought I would share with you just visually, right? You can see with your eyes, you don't have to know anything about the product, that something is going on when people use this tool. So here's a patient. This is March 7th of 2020. Puts a patch on every day. 6 weeks later, obviously the hair regenerated. There is something about stimulating the GHK peptide pathway that accelerates wound healing of the skin, hair follicles. I'm just quoting from the research I shared with you a minute ago. So you saw the research and now you see the evidence. I would suggest if you could if a supplement could make your hair grow back like this, you would hear about it on Dr. Oz. It'd be everywhere. It'd be like people would be be like Black Friday at the market to try to get your hands on this stuff, right? I mean, people spend a lot of money trying to regrow hair. So here's something that does it from the inside out by working on stem cell pathways. That's a pretty cool little case study. Dermatologically, cosmetically, here's another case study. This woman had the foresight to say, hey, I'm starting on day one. Here I am about 6 weeks in, and here I am a year later. And you can just see there's a different brightness. There's a different tone to the skin. And it's not a procedure. It's not a surgery. It's none of that. It's just GHK peptides have been shown, again, I'm quoting the research, to tighten loose skin and improve elasticity, skin density, and firmness, etc. You can read that right there. I mean, it's just what the research says, and then you can see it in front of you with your own eyes. So this was part of my education as I got into it. I was like, man, there's legit research. There's about 500 published studies on GHK copper peptides. The information is pretty incredible. And now here's some case studies. So as I go, I'm going to show you a couple more that get a little more, I don't know, what I would say is more profound. So you've seen some hair, you've seen some skin, that's great, doc, blah, blah, blah. But let's see what else profound changes can happen from the GHK peptide pathway, okay? So this one is a big influence on me because as a chiropractor, I'm treating people with thoracic outlet syndrome and radiculopathy and neurological problems, disc bulges all the time. It's part of our practice. We help them. And if there's a tool out there that helps them even more than what I do, well, then I want to know about it, right? So here's a patient in November 2018. Here's this person's MRI. You can see this is an MRI. The spinal cord's right there where my cursor is. You can see disc bulges at the C5 disc. Looks like the C6 and C7 are fused. I'm not sure if they were born that way, if that was post-surgical. And then you have the C7 disc pushing out into the cord pretty hard too. I mean, this is pain. This is suffering, guys. And this is a neurological surgery. I mean, that's literally all that the world has to offer us is, hey, operate. This person decided to go a different path. He started working with patches back in 2018. And about a year and a half later, he has another MRI. And the differences are incredible, right? So just paying attention, you can see the labels here. And I've highlighted it for you. So this is the C4 disc. Here's C5. It was bulging over in November. Now back in April of 2020, you can see it's cleaned itself right up. You can see the C7 bulge has, you really can barely see any bulge there at all versus this one that was almost going halfway across the cord. And again, the surgeon himself was like, hey man, it's a miracle. And he hasn't seen stuff like that very often in his career. And I bet he hasn't because most people just say, hey, it hurts, let's cut it. But I admire people who, are willing to try a different experiment to see how that works. So this is what the GHK peptide, the stem cell activating patches did for this individual. Now, the next picture I'm going to show you is gross. So I'm just going to give you a warning if you're, eating some, some stir-fried rice or having some dinner, put your food down, wipe your mouth clean, step away from the table because what I'm about to show you isn't that pleasing to the eye. Okay, you've been warned. But it's a great, great case study. That's why we're doing it, for the sake of science, okay? So this is a sore on a man's back, and he's in his mid-50s, and he has something wrong with his back. You don't have to be a doctor to know that that's a problem. It's an open wound, it's a sore on his back for years. No amount of antibiotics, corticosteroids, or any kind of medical treatment. They can't find anything wrong in his tests. The body can't heal it, but there's nothing they can figure out that's wrong. That's a sufferfest. Okay, imagine carrying that around on you all the time. His brother gets into the stem cell activating patches and knows that they can help with skin repair and wound healing. Says, hey, John, just try the patches for a month and see what happens, right? What does this guy have to lose? That's where he starts. So he starts putting a patch on every day, and you wear the patches from the morning till the evening, and you take them off. You wear them about 12 to 14 hours. They literally just stick on your skin. I'll show you a couple pictures, and that's it. But this guy puts them on day one. Now, what he says is, as soon as he started wearing the patch, the skin started to hurt. So it's kind of numb. It kind of when you have a big, nasty, dysfunctional part of your body that your body can't heal, it's like having a room in your house that you can't clean or you can't fix. So if you can't fix it, for whatever reason, you don't have enough life force, enough vitamins, enough nutrition, there's not enough blood flow, whatever the thing is, your body will like wall that off. It'll just throw up some 2x4s, put some, drywall up, texture it, paint it, and just hope that nobody accidentally knocks that wall down and finds a big gross mess back there. Well, that's kind of what his body did. If your body can't heal something, it'll just ignore it. But as he started to wear the patches for the first few days, it began to hurt again, which is actually a good sign that healing is starting. It means the body's paying attention again. And all the dead skin began to, unfortunately, rot and fall away. So he kept wearing them day after day, and in about 2.5 weeks, he was right here on the left hand of your screen. Now, I'll admit, that still doesn't look very appetizing. That's pretty disgusting. But what you see is healing taking place. The redness is gone, the swelling's gone. You can see that the skin is repairing itself, the connective tissue. The connective tissue is repairing itself. And that is exactly what GHK peptides do. That's what stem cell activating patches are designed to do. And about 4 weeks later, after a month of wearing the patches, look at where this gentleman ended up. It blew my freaking mind when I saw this. Guys, I've seen miracles in practice. From having people go to counseling, from giving them chiropractic adjustments, from working on hiatal hernias, from ileocecal valves, from detoxing, from herbs, from doing organic acid tests. Everything that I've shared with you, that we've poured our life into over the last 8 years, it all works. It all works. But if something works like this, you got to just tell me more, man. I got to find out more information, because this is something I think could help my patients, right? And it can help you. So that's incredible healing, right? So my thought is, again, bodies build, they will quadrant something off. They'll if something can't get fixed, your body will try to ignore it, and it'll try to it'll encapsulate it and try to leave it alone and hope that maybe tomorrow there'll be a better healing opportunity. They can take care of it then. But what I think happened in this case is wearing the X39 patches that you're about to learn about and activating the GHK peptide pathway, more stem cells were made in this man's body. And those stem cells were directed by the body's intelligence right where the problem was, and they started to repair and to heal. And that's the power of the body. The body can heal itself. Every doctor worth their salt knows that. They used to say that the doctor amuses the patient while the patient's body heals itself. There's some truth to that. But if we can speed that process up, let's figure out how we can do that. That could help people. So this is a really simple idea, guys. It's a simple product. You literally wear a little patch, just like she has on the base of your neck or under your navel. And like I said, you wear it in the morning, and you wear it for around 12 hours, and you take it off and throw it in the trash. The next day you put another one on. That's how the process works. And while you wear it, your body heats it up. And there's nothing chemical in the patch. There's no magical compounds or chemicals crossing into your skin. There's nothing like that happening. In fact, the only thing going from this patch into your body is a wavelength of light. All right? It is just that basic. Your body warms the patch up as you wear it. The patch, it has a special crystal matrix embedded in polyester, and the patch then reflects a specific wavelength of vibration, a tuned wavelength back onto the skin right underneath the patch. And it's that specific wavelength that triggers the cells under the patch to activate GHK. Well, you just learned about it with me, right? I've been spending weeks pouring over this stuff. I'm sharing with you my best stuff. But this patch, when worn during the day, will activate GHK, which activates your stem cells. Then your body and its intelligence will push the stem cells around to where they're needed, and you'll benefit somehow. We've been using this with dozens and dozens of patients. People report better sleep. That's one of the main things they say. They say they have more energy. I have a patient who has a diagnosis of some form of dementia. It's really kind of sad. It doesn't meet the it's not mad cow disease. It's not Alzheimer's. It's not Parkinson's, but it's called multiple systems atrophy. And this individual wakes up, can barely get himself dressed, can't do chores, doesn't help his wife out. He's kind of he doesn't do much when he's in this, and when he's unhealthy. He has some breakfast, has a cup of coffee, sits in a chair. A couple hours later, he falls asleep, naps for a few hours, wakes up, putts around, has lunch, goes back to sleep, sleeps, watch movies, watch TV, doesn't really interact. And this is his life. It's really sad. He sleeps like 15 hours a day. So I know his wife, sweet person. She's a saint. Imagine having to take care of somebody like that, right? I mean, it's a burden. So I mentioned, hey, try these patches. I gave her a few to try. She goes home on a Saturday morning, puts a patch on this guy right at the base of his neck, and I'm telling you, he's got this. He's diagnosed medically, multiple systems atrophy. They just tell her, hey, he's just going to get worse. Just deal with it. That's all we can do. So he puts a patch on. They have company over. He gets out of his chair right in the morning and stands up and talks to people. Walks around the house for like 5 hours. She couldn't get him to shut up. Right? He literally didn't nap all day long and was starting to participate in the house, starting to help out with chores and do little projects, starting to act like a normal, healthy 72-year-old. Next day she woke up, gave him a patch, same thing, got out of bed, didn't fall back asleep, up and active, started to move around, get some exercise, walk around the block. I mean, he's seeing some change. Same thing on the third day. Now on the fourth day, she's busy, forgets to give it to him, and then boom, right back to his old pattern. Wakes up, putts around after breakfast, has some coffee, sits in his favorite chair, and falls back asleep. That's no way to live, okay? So they got excited, and they've been on it now for several weeks, and it's made a permanent change for this guy. I mean, he gets up out of bed, he doesn't sleep during the day, he's interacting, he's talking to his daughters and his grandkids, he's out walking and exercising. I mean, for just putting a patch on your skin to see that stuff change, I'm telling you what, guys, I've never seen anything so easy to help people, right? I mean, coffee enemas and big detoxes, they help people, but they're kind of hard to follow, and they're kind of expensive. So if you can find something that's really affordable, that makes a difference, that works on stem cells, it's kind of a no-brainer, okay? Who should use them? Well, probably at least 4 people in this picture, right? Raising kids is stressful. Nobody works harder than stay-at-home moms. I don't care what your job is. I've talked to thousands of people. Stay-at-home moms are just the hardest working humans in the world. It's really hard to raise kids all by yourself and just deal with them all day long. We love them, but man, it's hard. Anybody says otherwise, it's crazy. But anyway, the patches should be used by pretty much anybody, okay? They're safe. Again, first, do no harm. We really ascribe to that principle. There's no other animals being harmed. We aren't harvesting stem cells from an unethical source. You're just making your own using a wavelength of light and your own body heat. It's brilliantly simple, and it works, guys. I'm telling you, this stuff has made a difference to my patients' lives. So if you want to try this out, if you're interested, if all this salesmanship I've been giving you over the last half hour, you're interested, what I would suggest you do to try this is you go to lifewave.com/mountain patches. So that's our little store, Red Mountain Patches. And you go to products and you just go down the list and you look for X39, right? So you just click on X39. I'm going to give you instructions. I'm going to give you everybody instructions in the YouTube description on how to purchase these if you're interested without having to sign up. I get it. Not everybody wants to sign up for multi-level stuff. No problem. But I do think this product's worth a try. It's really pretty exciting. So I'll give you those instructions on the description. Then for those of you that are a little interested maybe in signing up, if that's something you want to take on, you have friends or family that you think might benefit and you're interested in, maybe starting a little business on the side, who could not use a little more income these days, then you can go to the join button right here and just follow the steps. It's real simple. Once you land on our page, either way gets you to getting your hands on the patches, guys. And at the question comes up, is it really expensive? How much does it cost? The patches, you get a pack of 30, and if you sign up for auto ship, it's about $3 a day. So for the price of a cup of coffee, you're activating your stem cells, you're making a difference on these levels that I've shared with you during this video. Okay, so again, I think it's just a really cool product. It's so simple. You don't have to remember to swallow pills. People love not having to swallow pills or drink stuff that tastes like a green juice or something. Human nature is such that give them something easy to do and they're more likely to do it, right? So those are your 2 options. You can just buy on our store, like a retail store, or if you want to join and work on your own, helping other people get patches, then you can join, okay? Like I said, these instructions, will be in the description. So I kind of threw them up here just to show you. This is the easiest way to get your hands on them without having to sign up and do any kind of relationship with the business. But if you just want to try the patches, try this. And LifeWave gives you a 90-day trial. They're like, look, man, we think this stuff works so well. We're so confident that this stuff is going to help you that try it for 90 days. And if it doesn't work or you feel like it does absolutely nothing, they will work with you on giving you your money back. So they believe that this is going to make a difference for you. So I hope this video was interesting. Like I said, 10 weeks ago, I didn't think about this or deal with this at all, but in those ensuing 10 weeks, we've seen just some really nice things happening for our chronic patients. People who would always need to get adjusted the same. Their sensitivities to foods were just challenging and never changing. They were just very sensitive humans. After being on the patches for a few weeks, they're reporting back to me, and I see it in clinic, that they're holding their adjustment. Their complaints are getting better. They're not coming back with the same complaint over and over again. And these people with such profound sensitivities to bugs and foods, they're highlighting that they're able to cheat, or they accidentally got exposed at a friend's house, and normally it would knock them down for 3 days, but they didn't really feel any negative effects. And so for those type of people out there, that's a huge win. A huge win to not just not get worse, but to actually feel like you're getting a little bit better is, that's the drug we're all after, guys. At the end of the day, that's the drug we all want, is getting better. I hope this video helps you find your way forward through that process. And if you have questions about the patches, about how to sign up or be a distributor, I don't check this all the time, but someone will check this periodically. The sales@redmountainclinic.com. So sales@redmountainclinic.com. If you're having trouble signing up or getting your hands on stuff, just let us know and we'll walk you through it somehow. But otherwise, guys, just thanks for being patient, being part of my channel. I really, really hope to have an adrenal fatigue, a new video coming out that I just really think will hit home for a lot of you out there and be good to share with the people in your life who are stressed out. So stay tuned for that. But otherwise, we'll talk to you soon. Thanks for listening. Adios. Bye-bye.